Mombasa with 4 cases. There are 3 more counties, each with one. That's Kwale. Then we have Kajiado and then Kitui with 1 case each. And at least 1,474 close contacts from the confirmed cases have been monitored. The number of people tested so far stands at 1,005, with the government targeting to test over 24 hours moving forward at least 300 cases. Now, to have less of the worrying numbers, Kenyans are being called upon to heed advice on controlling the spread of the coronavirus, which is now being transmitted communally as opposed to the initial spread which was imported. Seth Olale reports that the new trend has led the authorities to introduce new stringent measures aimed at curbing the rate of infections.
Nairobi residents have been restricted from travelling up country. The announcement made by the Ministry of Health is seen as a precautionary measure aimed at preventing the mainly young urban population from interacting with the elderly.
Statistics have shown that majority of our elderly people live up country and that they are likely to get exposed, as it happened in Italy, by this kind of movement.
Boda Boda riders will be allowed to carry only 1 passenger, and both the rider and operator must wear face masks.
We expect Boda Boda Association leaders to oversee this process and ensure its implementation.
Employers have been requested to release their staff by 4 p.m. to allow them enough time to reach their homes before the 7 p.m. curfew.
The 4 p.m. departure is not to say that you start reducing people's pay or people's salaries.
The government says the infection has entered the community transmission stage, a change from the initial import cases. It warns that the numbers of those infected could reach up to 10,000 confirmed cases by the end of April.
Our modeling puts us at having about 1,000 cases by the first week of April. And we postulate that we'll have 5,000 cases by mid-April.
There is no pattern that we can really say, this is the one that Kenya is going to follow. Everything depends on what we do.
What may work against us, of course, is our weak health system. And of course, our disease burden, especially HIV.
The Ministry of Health says that it will increase its daily testing to target about 300 people each particular day. This will focus mainly on those in quarantine designated areas. Meanwhile, the High Court has ordered the Inspector General of Police, Hilary Mutyambai, to within 48 hours publicize in newspapers of national circulation and concurrently file in court for scrutiny guidelines on the conduct of police officers enforcing the Public Order State Curfew 2020. The court has also barred police from using excessive force while effecting the curfew, and also not to interfere with media coverage of the same. The court, however, did not pronounce itself on the Law Society of Kenya's request to have the curfew start at 10 p.m. instead of the current 7 p.m., but has set the hearing of the matter for 2nd April 2020. Seth Olale, NTV.